All right. Dr. Morrison, you're ready to roll? Okay. Let's see if I can be. Well, good afternoon, everyone, and thanks again for joining us. We're here to give you a brief overview of where we're at after the last couple of days. We didn't initially plan. I think it was necessary for us to be out today and hope to be joining you later in the week with a more wholesome update on schools and other aspects, which we're still planning to do. But just given the information and numbers over the last 48 hours and a lengthy discussion with Dr. Morrison and Cabinet this morning, we thought it was best to come out and do a briefing with you as we continue to make it the priority to be as open, as transparent with Islanders as we can be. We continue to monitor Omicron daily, and we've been seeing high numbers and higher numbers than we're accustomed to. And overall, we've been doing okay, which is a positive. But as Dr. Morrison will explain in a few moments, we're not just seeing increased cases, but we're seeing cases across a broad spectrum of the province in a variety of settings. As you know, yesterday there were outbreaks in community care facilities and daycares. Now today we have cases connected to other settings connected to some of our most vulnerable Islanders, and that is most certainly cause for concern. As much as we are eager to be done with this, it's not done with us. For a number of days, we have been hopeful as we monitored the impacts of Omicron that things were trending in the right direction, but we have always known that we have to deal with the information that is before us and the information that we learn as we go through this, and to allow that, as we have for the last 22 months, to be the key guide in our decision making. We have been careful as a province to err on the side of caution, to protect our most vulnerable population and to limit the impacts on our healthcare system to the extent that we can. The many phases of COVID have changed and adapted, but the overall focus of our responsibility has remained just that. And as an example, on Saturday, we had 2 hospitalizations. Today, Dr. Morrison will announce that we have 6. That's something that we need to watch and continue to watch very closely. We've known all along that the more people who test positive in the province, particularly in the numbers here and elsewhere, that will evidently lead to more people needing to get attention and perhaps to be hospitalized, even though the vast majority of people are only experiencing minor symptoms or a minor level of sickness. That is a good thing, and we hope that continues here in the province, but it's something we need to continue to watch very closely. It's not quite as simple as saying my cousin was positive and it wasn't that bad. Because there are certainly cases where people are getting sick, getting really sick, and requiring medical attention. And the more people who test positive, the more likely that someone is to get very sick, and that's what we've been watching and that we continue to worry about. When we talk about the stress on our healthcare system, for example, it's not just about the number of people sick with COVID. It's the number of people in our system who might not be able to work because they're impacted. And the implications that it has or can have on just the everyday part of our healthcare service delivery in Prince Edward Island. As well as a small province with limited specialized healthcare services, we rely very closely on Nova Scotia and New Brunswick to help us deliver on some of these socialized or specialized services. And with growing hospitalizations and increasing pressure on the healthcare system in those provinces, that requires us to watch very closely here and to be doing everything we can to try to triage that to the best extent we can should we need to, because that is an overall impact on Prince Edward Island as well. We're still trying to understand where we're at in this process, and Dr. Morrison will talk about that in a moment. That's been the challenge and frustration for sure, I know that. We have been watching really closely to see, for example, if our cases are doubling on a daily basis or on a regular basis, to try to measure the full extent in that province, and I think, not that I need to share more than Dr. Morrison will share, but, our cases doubled today from yesterday. And we need to take a look at where we're at over the next few days to figure out if that is an anomaly, if that's the regular, what we can expect for the next few days. And that is what we're dealing with, and also causing us to take some pauses and to have greater level of concern. I also spoke to many of my colleagues last night on the call with the Prime Minister. They speak of cases in some jurisdictions cresting the third week of January or the end of January. And we don't know where we're at in that curve right now, if we're ahead of the curve, the middle of the curve, or behind the curve. And that's really what we're trying to figure out. I think we are safely to say that we're not at the crest yet. And that's another thing that is causing us to be very cautious and to continue to assess the situation over the next number of days. We need the data and the health and the science information to know and to learn that and to understand where we're at. And until we know that, it's going to be very difficult for us to make unilateral decisions on the way to getting back to normal. As I say, we've always took an err on the side of caution, and we have seen nothing lately to change that approach. Look, and I also, just in speaking directly to Islanders and all those who might be tuned in today, that I know you all have your views and your opinions and your thoughts as to what we should do. Many of you have shared them with me, and I appreciate that. I know there are political parties across the province and across the country who are sharing their views and thoughts, and all of that is important. And just because we have differing views or opinions doesn't mean none of that or either of that is important. But, I get that. But this has never been and will never be about trying to be popular or trying to make a decision to appease one's views or thoughts. It's always been about, and to continue to be about, health. And even though we're 22 months into this, and I know this is the most frustrating part for me, for Dr. Morrison, and for most Islanders, is because we're tired and frustrated and wish to be done of this. But the reality is we face many more I don't knows and I'm not sures today than we have perhaps at any point in the pandemic journey to now. I just want Islanders to know that there are thousands of people working across all sectors of our government and all sectors of Prince Edward Island. They're working hard day and night to get us through this as safely and as quickly as we can. We know that there are costs for doing things and costs for not doing things. We're trying to use the best information that we have to err on the side of caution and to make sure that that cost that we are paying is as limited as it can possibly be. But we know that our decisions, or the decisions that maybe we're not making, are having impacts on Islanders, on island families. We're very much aware of that, and we're doing everything we can to try to limit that impact as we deal with COVID. We have been here before. We will get through this. I think we feel like we can see the finish line, and I know that's probably as much of a frustration for Islanders as anything else, that we really just want to be done with this. But until it's done with us, we have to put the shoulder to the wheel, keep doing what we've been doing, and to try to make our way through this. And with that, I'll turn it over to Dr. Morrison for the most recent update and the numbers.
Good afternoon. Thank you, Premier. As the Premier mentioned, this is a short update, basically including some information regarding a number of outbreaks that we've seen in the last couple of days. And as the Premier also mentioned, there'll be a briefing later in the week with further information and further update related to COVID. As of 8 o'clock this morning, there are 304 new cases of COVID-19 to report, which is our second day in a row over 300 cases, bringing our total active cases to 1,694 cases. Over the last 7 days, we've had an average of 190 cases per day. There are 6 people in a hospital being treated for COVID-19, including 1 person in intensive care. And although it's not all about daily case counts, and we certainly want to look at hospitalizations, our daily case counts continue to rise, which is concerning. We know there are approximately 8,500 people as well in self-isolation as the result of being positive cases or close contacts. We know we have not yet reached the peak of our cases. We are expecting to see cases rise over the next couple of weeks. And I think we've said right along that we are trying, all the things we're doing are trying to minimize how high that peak is and how fast it goes up. And it's really incumbent on all islanders to do everything we can to contain the transmission. And that's both stressing the importance of following public health measures that have been put in place to help our whole community and our population here, but also our personal measures as well in terms of even staying home when you're sick, washing your hands, and wearing your mask. And all these messages we've been stressing over the last number of months, almost 2 years, these measures together have proved to be a very important and our best defense against this wave of COVID-19. But Omicron is proving to be very aggressive, spreading rapidly and quickly, seeking out those who are most vulnerable. At this point, there are 6 hospitalizations, which is manageable at this point for our colleagues in acute care. The continued rise in our new cases and active cases could have significant impact on the need for acute care. And we know that hospitalizations lag behind by at least 2 weeks to when you see a high rate of cases. That's what we call a lagging indicator. The more people have COVID-19, the more likely some are going to have serious outcomes and require hospital care. We need to work together to limit transmission to further protect the health system from being overwhelmed by people who require emergency, acute, and critical care. Our health system resources are not infinite. On the weekend, we reported an outbreak at Musqueam Villa, a community care facility. 8 of the 27 residents have tested positive, along with 6 staff members. All residents are doing well and are receiving care in the facility. Today, there are a number of new clusters of cases and outbreaks to report. Garden Home Long-Term Care Facility, there are now 2 residents who are positive for COVID, and further testing is taking place today. As a preemptive measure, visitation to the facility has been restricted with provision for 1 partner in care to visit each resident. There are a number of outbreaks and cases in early learning child care centers across the province. There are 9 centers impacted and 7 child care facilities closed today across the province. We are working with this sector to support staff who are close contacts in the test to stay policy. Updated outbreak guidance is being shared with the affected centers this afternoon. 5 cases within a population that regularly access shelters and outreach services in Charlottetown is also being declared an outbreak. Guidance and direction regarding the use of masks and other personal protective equipment and other measures, including rapid antigen screening, to limit further transmission is being provided to community-based service providers. Additional PPE and antigen tests are being distributed to them. There's an outbreak at the Provincial Correctional Centre with 3 staff and 1 offender testing positive. We are working with staff in justice and public safety regarding testing and other measures to contain further spread within the facility. As I mentioned in the beginning, we are sharing the information we have about these outbreaks today, and we'll know more as the days go ahead in the next few days. All service providers and those impacted, including individuals and families, have been very cooperative and supportive of the need for additional measures. We mentioned earlier we plan to have another briefing in the next couple of days and we'll be able to provide updates. Our public health system is stretched as we manage the surge in new cases and outbreaks in high-risk settings. Our colleagues in health PI and in the private sector are also being challenged to meet the needs of islanders at testing clinics, vaccine clinics, and in programs and service areas from one end of the province to the other. We ask for your continued patience as we are all working as fast and hard as we can. And this is not the information we wanted to be sharing this afternoon. We have been fortunate to have avoided significant outbreaks in high-risk settings in the first 21 months of this global pandemic. Omicron is proving to be much more challenging to manage and in many respects is like a totally new phase of the pandemic. While it is discouraging and disheartening to know that Omicron is spreading so quickly in our province, affecting so many families and disrupting lives, we can be grateful for the many measures in place to mitigate and fight back against this variant, including our vaccination, our testing, isolation, test-to-stay policy. There are also a number of programs to provide financial supports for people who are affected by COVID-19, and the Premier has mentioned those previously. Most importantly, residents of PEI have demonstrated their resilience and willingness to buckle down and do what needs to be done to fight back against this pandemic. I know the Premier mentioned the finish line's in sight. Sometimes I feel like we're in a tunnel, and but the tunnel ahead of us is definitely shorter than the tunnel behind us. And I do know we are going to get through it, and we will do it together. So as we continue to do everything we can to protect ourselves and others, let us continue to be patient and continue to be kind. Thank you.
Thank you very much, Dr. Morrison. We'll go now to some questions from our friends in the media. Maybe we'll begin with Bonjour Julianne, Radio-Canada. Can we start with you?
Bonjour.
Yeah.
Bonne année à vous. Happy New Year to you both. Ma première question pour vous en français, Dr. Morrison. On n'a jamais vu autant de cas, autant d'outbreaks. Pourquoi aujourd'hui vous ne décidez pas de mettre en place un circuit breaker alors que vous l'avez mis l'année dernière quand il y avait beaucoup moins de cas, beaucoup moins d'outbreaks?
Bonne année, Julien. Alors, on a plus de cas, on a plus de outbreaks, mais on a déjà mis vraiment en place depuis avant Noël beaucoup de mesures qui sont, on a mis, on fait isoler les gens qui arrivent, on continue l'isolement des contacts, les cas, on diminue le nombre de personnes beaucoup d'établissements. Il ne faut pas sortir après une certaine heure au resto. On a fait beaucoup de ces mesures, mais on sait qu'on c'est vraiment avec Omicron, il faut ça transmet tellement rapidement et tellement vite. Il faut vraiment qu'on fait les choses qu'on sait qu'on doit faire, mais on doit les faire tellement vraiment mieux qu'on a fait avant. Alors, si vous portez votre masque, il faut en bien porter, pas vous sur l'oreille ou quelque chose comme ça. Il faut qu'on fait bien les mesures qu'on a en place. Et aussi en balance, on fait un balance parce que il y a les impacts qu'on a sur la société, qu'on a des lockdowns qui sont même plus sévères qu'on a déjà. Alors, on regarde cette balance, mais c'est les décisions qui sont difficiles.
Ma deuxième question, je vais la poser en anglais parce que je voudrais avoir une double réponse, s'il vous plaît. I'm going to ask that question in English for you first, Premier. Premier Higgs said yesterday he's maybe thinking about ask his population, for a mandatory vaccine. Do you think about it? Do you think it's a good decision? Do you think it can happen in the next few weeks? I would like an answer in English and in French, please.
Well, I will answer in English. It wasn't something that was really discussed at length with the First Minister's call last night. I think our approach here has been, we have a tremendous adherence to the public health directives, one which has been islanders lining up to get vaccinated twice now, 3 times. We have, I think us and Newfoundland remain neck and neck as to who has the highest level of vaccination amongst our populations in general, and that is a good thing. I think, from my perspective, I'm not sure who isn't vaccinated now that is possible to be vaccinated. I think we have a percentage of our population who, for whatever reason, have decided that the vaccine isn't for them. I have seen news stories from across Canada and beyond that if we had 100% of our population vaccinated, that we would probably wouldn't be in the situation we're in. And I have no reason to believe that isn't true. But reality being what it is, I don't know if we mandate a vaccine other than holding people down and putting it in their arms, which is something we would never do. I don't know how we would get to that level. So I've never had a conversation with the Prime Minister about this directly. If he were to ask me the same question you do, I would give him the same answer. I don't know how we would go about vaccinating those who aren't vaccinated. We already have, a pretty strict with the vaccine passport, for example, so there is limited interactions that people can have if they're not vaccinated, which we all know has caused great frustration for many of those. But, I think there's very few remaining vaccine hesitant people in PEI. And if there are, perhaps we can do a better job of trying to explain why you should have a vaccine. I don't know how we would go about vaccinating those who are just totally opposed to getting it. I don't know how we would implement that.
Julianne, maybe I'll start in English and just to add to the Premier. So we have 95.7% of our eligible population 12 and over who've had at least 1 dose of the vaccine, 92.4% who've are fully vaccinated. As you know, we have over 25,000 Islanders who've had their booster doses. And we have a Vax Pass in place. We have a test or vaccinate policy for a lot of people who are in vulnerable sectors. There are those who've chosen not to be vaccinated, those who cannot be vaccinated, and those who may not mount the same response to vaccines because they're immunocompromised. We've started vaccinating our children, and so I think we're doing all the things that we can to try to protect the population as a whole. And we'll continue to do that and making sure people have the best information about vaccines and we can answer their questions, I think will continue to be really important. Alors, en français, pour les vaccins qui sont obligatoires, je pense que c'est la question. Vraiment, ici à l'île, on a des niveaux de vaccination qui sont assez tellement hauts et puis on veut encourager les gens. Et en addition, on a comme le Vax Pass et ou Test or Vaccinate. Alors, on fait tout ça pour essayer de protéger tout le monde. Et même et aussi les personnes qui sont pas vaccinées parce que choix ou ils peuvent pas, ils sont allergiques ou ils peuvent pas monter une même réponse au vaccin. Alors à ce moment, c'est pas quelque chose qu'on discute. On n'a pas vraiment discuté pour obligatoire, mais qu'on fait toutes les mesures hors de ça.
From The Guardian.
Hello. Thank you for this briefing, and especially since it was unplanned. Dr. Morrison, I really liked your comment to Julianne about how our measures are in place, and now is the time to be, adhering to them even more than we ever did before, to do our very best to adhere to them the very best we can. One of those things is, I believe, boosters is something that is part of that. And where's my question here? Are you noticing any vaccine fatigue around boosters? When you said 92.4% are fully vaxxed, that number hasn't really changed much. And so just wondering if there's any sort of, fatigue on going to the clinic to get the booster.
Hi, Alison. So, and I think it's worth reiterating the first comment that we have measures in place across PI, so picking up on the previous question, and it's really the time right now to make sure we do make choices as well to continue to do those measures and do them the best we can. And we all want to get back to normal and not be dealing with this in the same way. I want my children to get back into activities. We all want them to attend school, and we want them. We will all ourselves want to participate in life in a different way. And I do think this is going to not be long lasting. It is for a few weeks more that are really going to be critical in terms of us following those measures. So for all of us, in terms of now, I'm sort of asked what the boosters. Oh yes, boosters. Oh yeah. Okay. So we have right now 74% of those over age 80 who've had their booster. And in terms of the most severe outcomes in terms of ending up in hospitalization, we know that those over 50 are one group that we really think it important to minimize the hospitalizations. But we still have some work to do on those boosters. But I think because of Omicron, we're not sensing a vaccine fatigue so much as people want to get into their boosters. And I know the pharmacies and Health PI have really are putting more clinics on this month to try to respond to that demand for boosters. And I mean, I really would like to see those percentages in the 50s, 60s, 70s increase to a level where we feel like they're going to be the best protected, as more of them are protected. We know 2 doses of vaccine decrease your chance of being hospitalized, and with that booster, it decreases that chance even more of being in hospital or severe outcomes. So that's really important for people as we go into these next few weeks.
And that actually leads into my next question, which was, are we on track to vaccinate, to the level that we wanted before Omicron kind of came? I know there was goals to have the 5 to 11-year-olds vaccinated and the boosters in arms. Are we on track to meet your desired goals back when you set them?
I believe so. So we know how many people from our earlier vaccinations are going to be eligible to be vaccinated this month. So we know there are about 40,000 people by the end of January who will be eligible to have their boosters. And based on the numbers that we have in terms of booking clinics and what pharmacies are able to do, they've told me they're going to have enough appointments for anyone who becomes eligible. We know we won't. Not everyone who becomes eligible will be in for a booster, but we certainly sort of plan on a certain number to be available for that month.
Thank you very much.
Grown by 2 today, because Dr. Morris and I were scheduled to go get our booster, but we postponed it because we're coming here to do the briefing. So,
Yeah, so
we will do our part as soon as we're able to, but we were scheduled to do that today, I believe.
yeah.
Yeah.
Say thank you.
We don't either.
Yes. So we're hoping those will be rescheduled.
Thanks, Allison.
Yeah.
Thank you.
Hi, good afternoon. Thank you for taking our questions today. My first question, I guess, is for Dr. Morrison. I'm just wondering, based on the number of outbreaks that are being reported today, that's sort of unprecedented for us here. I'm just wondering how confident you are that the current measures can sort of contain the situation right now, and I guess maybe what things would have to look like for more measures to be brought in.
Hi, Brittany. So, I mean, I think we've said over the last number of weeks, we are not going to be able to stop this wave or prevent Omicron like we have in other variants or in other parts of this pandemic. what we're trying to do is slow it down, contain it, try to protect those in vulnerable settings. And I think a lot of the measures, really picking up on Allison's questions, a lot of the measures that we have in place are designed to do that, but we need to make sure we're doing them really well. And that means that whether you're working in those settings, going to those settings, or more broadly in our community, we all have that responsibility. So we are looking daily at our hospitalizations, our turnaround time for testing, our how many people are being tested, our hospitalizations and our rates around us in terms of other Atlantic provinces, and also the capacity even within public health to manage all these outbreaks. So all those we're looking at them every day, and we ask the question, how, what else can we do? Do we need to do what we're doing better? And what are the impacts of either doing more measures or not doing enough? So we will continue to watch those. We're looking at them as indicators. And they're also, and part of those indicators are we're watching our percentages of people who are boosted to protect Islanders. We're watching our percentage of children aged 5 to 11 who have their first dose, and soon they'll start to get their second dose, some of them. So those are also part and parcel of what we're watching to see what else do we need to do to protect the province and to protect the healthcare system, so that it's there for therefore when we need to go to hospital because of COVID, but also to protect the healthcare system so that it's not overwhelmed, that if we're in a car accident or have a traumatic event or have for any kind of care, that it's there for us to help.
All right, thank you. And that sort of leads into my second question. It was mentioned 6 hospitalizations at this point today, which right now is manageable. I'm just wondering, at what point would PEI reach an unmanageable situation in hospitals, and how concerned are you that, based on current case numbers and the way that they're trending, how concerned are you that we might reach that point?
Well, I think I know Dr. Gardam has addressed some of those types of questions as well as CEO of Health PEI, and I know they're following what's happening in the province really closely, and that's why everything we're doing now to try to limit how many people get sick, knowing that if we have too many people sick, it inevitably will lead to further hospitalizations and the need for acute care. I think our hospital has been preparing, and our whole system, healthcare system, has been preparing and doing a good job in trying to anticipate what lies ahead. I think most people who have COVID with Omicron, they have mild symptoms, but we are certainly aware that there's a certain number of people who will get more sick. I think at this point in time, it's manageable, but the more we can do to not let the peak go too high or too fast, we'll be able to manage it better as a healthcare system.
Okay, thank you very much.
Jessica Doria Brown, CBC.
Hi there. This is a question for Dr. Morrison. The first one is whether you can share the vaccination status of those currently in hospital right now with COVID.
The reason I'm smiling is someone said to me as I walked in, someone's going to ask you that, and I don't have it here. But we did look at it last night. It's going to be posted on the website and added to the website, hopefully by tomorrow. And sometimes there's just a delay in making sure we have the information on admitted patients, and so that will be added as part of the information. Right now, it's about the cases overall vaccination rate, but it's also it'll also include hospitalized patients and partially vaccinated, fully vaccinated, and unvaccinated on the website. So I'm sorry, I don't have it right here, but I didn't get it in time before I came down.
Okay, and can you give any more details on where we're at in terms of the current outbreaks, the long-term care centers, the correctional facility, daycares? These are obviously places where people are extremely vulnerable.
So I'm not sure. As you mentioned, we are announcing outbreaks today in a community care facility, long-term care facility, in corrections, in a population that often is in shelters or seeking care at outreach centers. So those are, as well as our daycares and our early learning. So there are outbreaks in multiple sectors, and I don't know if I mentioned corrections there. And so it is of concern. We have the residents at the community care facility are all doing well. The last report from the facility, the residents at the long-term care facility are both they're not in hospital, they're in at the facility. So I'm not sure in terms of updates. I mean, a lot of this is information that really has just happened within the last day. So I'm not sure if there was something else specific you wanted to know.
Sorry, can you hear me, Dr. Morrison?
Yes.
Okay, sorry, just trying to clarify. The question is really, is it a sign that our measures aren't enough, and is there more we could or should be doing to keep these most vulnerable people safe?
Well, I mean, I think I feel like I may have mentioned it before, but it's worth mentioning again that we have measures in place that we need to make sure that we are doing them better than we've done them before. So making sure that you're not going to work when you're sick. We have making sure that you're masking, that there's no break in the infection prevention control measures that the guidance has been very clearly given. That we are keeping our circle of contacts very small, because that's often where it can start, and I think that's really important. I think. We have limited visitation in these facilities. As soon as there's a sign that anyone is positive, for instance, the Miscush Villa, it was closed to visitation since the end of 2021. So these are all the measures that should work, but they are. But we all need to make sure we're following them, both the public health measures and our personal protective measures, as best we can.
Okay, thank you.
Yeah.
Okay, well, I think that brings an end to our hastily pulled together media conference. I want to thank our friends in the media for responding as quickly as you have, and Dr. Morrison as well for her patience and leadership today. It was very helpful to all of us. So I hope Islanders have a good day and stay safe.